Well, they're at it again, folks. It's kind of the same old deal. Actually, earlier today, the Senate Majority Leader, Harry Reid, announced his intention to include a government run insurance plan with an opt out provision in the Senate version of the health care legislation. Now, with the support of the White House, Senators Dodd and Backus, they stated that the best way to move forward is to include a public option with opt out provision for states. Now, Mr. Reid, he said in a news conference under this concept, states will be able to determine whether the public option works well for them and will have the ability to opt out if they so choose. I believe a public option can achieve the goal of bringing meaningful reform to a broken system. Now, I don't know exactly what that means to you folks, but I know what it really means. It means that the burden is going to be put on the states that choose to opt out. It will cost them in taxes as well as the citizens that live there. So the bottom line is there won't be no opt out. It'd be more profitable for the states to stay in the system, and therefore we can consider it to be a huge run government health care plan that will fail just like Medicare, Medicaid, Social Security, the post office. All these institutions, folks, are in rambles. They're in trouble. And what makes us think if they can't run those things, why can we add another responsibility to the government that can't run the programs they already have and add to them a further, much larger program of healthcare reform? They're not going to do it. They can't do it. And if they do, it's going to cost you, your children, your children's children, and their grandchildren more money than they could ever afford.